Hey, it's Dr. Travis Whitney with the Innate Healthcare Institute, and today we're going to go over our MSC's umbilical cord tissue rejected from the body. Common question we get. Thank you for everybody that has wrote in or emailed in and asked this one, because there is a lot of misinformation out there regarding this. A lot of it does stem from competitive businesses, places doing autologous treatments where they're using bone marrow or adipose, and they're very threatened from umbilical cord tissue. Maybe they're afraid that if patients are getting that, then they're not going to use something like bone marrow. The short take on this is are these cells that are extracted from an umbilical cord used for some sort of treatment purpose, like arthritis or an autoimmune condition or autism or a whole host of different conditions? The thought is that they're rejected from our body. This is seen a lot in, like, when you're talking about with blood work, right? So you have to like match up the certain type of blood that you're getting, you know, unless it's like there's the whole universal donor and universal acceptor thing. But you know, if you have blood a certain blood type, you want to make sure that the blood you're receiving is a match for that. Or you can have like a bone marrow or something donation where you can't have problems. So the thought is that because these cells are coming from another body, a donated umbilical cord, this is something that we call an allogenic, meaning it's not coming from yourself. Whereas an autologous or autologous treatment is where you would extract cells from, say, your fat tissue or your bone marrow. So the thought is that these cells must be rejected, they must be bad for you. And it's not the case at all. It hasn't been the case for a really long time. There's some really well published research out there demonstrating that these are safe. And so the shorter answer is no. They're what we call immunoprivileged, or another word you'll hear is immunotolerant. So our immune system is not recognizing these cells as foreign, any evaders. They're not gonna attack them, and you're not gonna get this graft versus host disease kind of response. So a couple of reasons why, we'll go over some of the science behind that, is they do have these umbilical cord mesenchymal stem cells. Sometimes you'll hear them referred to as mesenchymal. They have a low expression of what's called an MHC. And there's two types, there's type 1 and type 2. And it stands for a major histocompatibility complex. And these are tissue antigen receptors on the outside of a cell. Let's draw one. So if we have a little cell here, let's do a little nucleus, a little mitochondria, and over here we'll have, we'll say that this is an MHC. So this is going to help our immune system. If this MSC is in the body, our immune system's constantly picking up on things, you know, bacteria, viruses, foods we eat, and they're determining if it's a threat or if it's okay, you're friendly, you get to pass. So there's a low expression of these on umbilical cord MSCs, which allow them to basically kind of go undetected by our immune system. In addition to that, the cells themselves have immunosuppressive factors. This is indoleamine dioxygenase, prostaglandins, transforming growth factor beta. So these are secretions that are coming out from the cell itself and communicating with these other cells in the area. And it's kind of like maybe like a safe word. So they're sending out communications that saying, hey, chill out, no need to come and kill me, no need to attack me. And almost in the same fashion, there's a modulation of these immune cells. So they're basically telling them, these cells are very anti-inflammatory, which is why they work so great in a regenerative medicine capacity. And so they're just doing that with the surrounding immune system. They're saying, there's no reason to be very pro-inflammatory. There's no reason to become inflamed. Everybody chill out, we're all friends here. So that's a short version. These are 3 of the main reasons why we label umbilical cord mesenchymal stem cells as immunoprivileged, immunotolerant. So I hope you enjoyed this video. Leave a comment if you have any other questions or something else that you'd like to see another video on, and subscribe to get the latest